Chronic asymptomatic pulpitis. It's an inflammatory response of the pulp to an irritant in which the proliferative forces are hyperactive. The exudates are minimal, therefore there is subthreshold intrapulpal pressure, which means the irritation does not exceed the pain threshold, therefore there is no pain. Exudates drain away through carious cavity, venous or lymphatic circulations, and adjacent tissues. Drainage of exudates causes a balance between internal and external pressure. Pressure balance causes tissue proliferation, which is an incomplete repair. Repair is incomplete due to the presence of toxic agents. Classification of chronic asymptomatic pulpitis. First, chronic ulcerative open pulpitis is a carious pulp exposure with formation of an abscess with surface ulceration at the point of exposure. The abscess is surrounded by granulomatous tissues, which contain young fibroblasts, young blood vessels and nerve fibers, plus chronic inflammatory cells. Signs and symptoms. There is no pain. Pain occurs only if drainage was blocked by packing of food or ingress of virulent bacteria, which changes into subacute or acute stages. History and visual examination. You can see an open carious cavity. Negative or slight widening of the lamina dura in radiography. Negative or slight response to high current in vitality tests. Number 2 in chronic asymptomatic pulpitis is chronic hyperplastic pulpitis or pulp polyp. It's an overgrowth or hyperplasia of granulomatous tissue into the open cavity. The pulp is lined by stratified squamous epithelium from the oral mucosa and contains few new fibers. Signs and symptoms. There is no pain unless the polyp is probed. History and visual examination. Wide carious cavity, frequently in the proximal surface, with the polyp protruding from the pulp chamber. Usually occurs in children and adolescents, in which the pulp possesses high resistance. The polyp appears as pinkish red globule which bleeds when probed. There is negative response to percussion. In radiography, there is negative or sometimes dense bone formation takes place around the apices of the roots of mandibular molars. There is no response or slight response at high current during vitality tests. Root canal therapy is indicated for all cases of chronic pulpitis. Pulp polyp should first be removed by sharp curette or cautery.